Welcome to Next Generation Healthcare, proudly presented by Optimal Telehealth. Are soaring health insurance costs for your family or business causing you stress? Tired of the long waits and high fees for a simple doctor's consultation? Then you've found your podcast. Next Generation Healthcare is here to empower you to take back control over your healthcare decisions, freeing you from the constraints set by insurance companies. In our episodes, you'll uncover the secrets to circumventing traditional insurance to access direct services from your preferred providers at savings of 40 to 50%. This podcast is a creation of Larry Stout, the visionary founder and CEO of Optimal Telehealth. Now, let's hear from Larry.
Hey there, fans. Welcome to this episode. I appreciate you coming in to talk with us today. We're going to have a very interesting conversation. I've got a special guest on today, and we're going to take a deep dive into telehealth and virtual healthcare. Just to kick off the conversation, I'll just share with you that telemedicine is over 100-year-old process. It can actually be traced back as much as 150 years. But it's only in the last 10 or 15 years that it has evolved into a consumer product. So as we take a dive into that today, I asked Wayne Orchard with Lyric Health, which is one of Optimal Telehealth's primary service providers. I've asked Wayne to join us. Wayne is a partner and executive vice president at Lyric. Corporation's name is MyTelemedicine, and some time ago they changed it and started rebranding, started marketing their services as Lyric Health. I'll say, based on my experience, the average consumer, and this is exactly what happened to me, the average consumer, if you ask them what they know about telemedicine or if they know what telemedicine is, they'll say, sure, I know what that is. But when somebody that is in the business sits down and explains it to you, you quickly find out you really have no idea what the capabilities are and what it's evolved into in today's market. So, Wayne, I'm glad to have you with us. I appreciate you coming on board.
I appreciate being here.
You bet. Let me just start by asking you, historically, what changes happened in the marketplace that allowed telemedicine to come forward and actually become a consumer product?
Back in 2004, the well-known, kind of like Kleenex, the 800-pound gorilla out there, called Teladoc, so they were the first company who brought virtual care into a consumer market, into the employer market. Because like you said, Larry, telemedicine has been around forever. I mean, from remote brain surgery to second opinions to all kinds of things. But it hadn't ever really been in a daily use on an employer or consumer basis. So, the gentleman thought at one point in time, back early 2000, hey, well, why can't we do this? And so that's when I was introduced to it, and the company I had previously worked for, we were the first ones to partner with Teladoc. And so I've been in this industry of virtual care since that time. And with that has been the expansion of services, but more so education and the consumers understanding what they can use virtual care for.
When I first came on board, and I'm going back a little further than you, it was just my general understanding, and I think this is kind of common sense, that a couple of things that facilitated it advancing so much is of course, advancements in communications technology, the ability to do video conferencing with very low-tech equipment, and also the relaxation of mostly state regulations that protected doctors. I mean, previously it was doctor getting a lot of trouble for diagnosing and treating a condition over the phone. But as the states relaxed their regulations on that, it kind of allowed things to move forward. Is that your experience? Am I on target with that?
Yeah. And the funny thing, Larry, is, state regulations, certainly always mold around to what the current environment is, right? And so as more things went virtual, other things, we're looking at the regulators going, well, hey, maybe this can actually be done. But how you think about it, and when I was a kid, growing up in a small rural town, if I got sick, right, my mom could call our family doctor, and the family doctor, oh yeah, it's something going around, and he just needs, amoxicillin, and I'll call that in, right? Well, when did that really stop? Well, when it really stopped was when insurance came around and said, oh, no, doctor, unless they come in to see you face to face, I'm not going to pay you a reimbursement.
Ah, okay.
So really one of the things that stopped the growth was the doctors being able to use a telemedicine platform, but also to get reimbursed. I mean, their time is money, but they do know that is a much more effective and efficient way to get through all the patients that they need to get through. So with that, not only the regulation side, but now with insurance companies and companies like Lyric Health that are out there that are on a subscription model where there is no claims, right? It's a zero cost, of, no copays or anything else. It's made it a lot easier for access and the providers to feel comfortable in providing this type of care.
Okay. I vividly remember when I was young, I was probably in elementary school, raised in a small farm town in central Kansas. I vividly remember sitting in the chair in our living room and the doctor actually coming to our house to diagnose what I had at the time was strep throat. But that was the only, it probably happened when I was younger, but that's back when doctors made house calls. But that's an era a long time ago that just doesn't happen anymore. So when I first affiliated with MyTelemedicine, at the time it was MyTelemedicine, and we'll talk about Lyric, the conversion to Lyric here in the future. But when I first affiliated, you were basically four services. You offered consultations with board certified doctors, 24/365, healthcare, behavioral health counseling services, patient advocacy services, and communications with a medical specialist. And that was it. That was telemedicine at its current best. And then all of a sudden, as things moved forward and people got a little more accustomed to it and began to embrace it a little bit, wham, we got hit with the COVID pandemic. What can you tell us about what happened during that time and how that affected my telemedicine and telemedicine in general?
Sure. So, we started MyTelemedicine in 2015, right? And as you stated, it was what I consider urgent care telemedicine, right? When you say telemedicine, what does it conjure up? It's cold, cough, flu, something that you just need, a one and done. There's usually no follow-up. There's no daily care. Medication is a 5-day medication or something. And it's real quick to get over. So that's what, in 2015, coming from that, and then the evolution was really about service. The technology to hook up a doctor and a patient, that's kind of out there. It's the norm. There's nothing really fancy about it. What the difference is when we came aboard, it was a very busy market, even, back then, was how to do it differently, right? How to get rid of some of the bumps, the hurdles, the stuff that I had gone through. My partner and chief executive officer founder, Ray Colon, was a co-founder of Ameridoc. And, and with that, he's having, the same issues that I was during the industry. So when we came together, said, hey, let's do this differently. A lot of technology was the answer to this. So by introducing a new way, easier way to get it, we got a lot of traction there. Then the evolution was the next step of, bringing in behavioral health, telephonic counseling. And that was just, again, because of resources. A lot of, urgent care business came to us all because it was about trying to get with a, it's just an easier open access, right? It was always about, how many doctors you have in your network and stuff when they're looking at insurance. Well, being virtual, we can cover a lot of areas with not as many doctors because you don't have to travel, right? So with that then comes of following the needs of the consumer. COVID, right, hit. And when it used to be 2 out of 10 people understood what telemedicine was, March of 2020, when doctors could no longer see patients in their own office because America basically shut down, all of a sudden it's 8 out of 10 people knew, oh, if I need to talk to a doctor, this is the way that I'm going to communicate. Well, now it's taking those services from that urgent care side to the doctors at that point in time were having to take care of chronic, illnesses. How do you manage someone remotely on daily medication and get their refill appointments and reminders and, prescriptions, sent to the pharmacy? So it was the need, I think any kind of consumer, market, it's always, okay, what is a need? And do you have an answer for that need? And one thing is, because of our technology, we've always been able to answer it very quickly, if not ahead of time. There's products that we have in our queue right now that is looking out into the future of what we can possibly do, in remote care and stuff. So, it's all about following the trends in education. And, really, Larry, everybody's living off of these things, right? And so healthcare, when it comes down to it, talking about the big carriers out there, they're not in the I would say the healthcare business, right? They're in the claims business. That's it. So to them, they really don't care if you have convenient service or not, because all they care is that if I'm going to have to pay a claim out, then I need to collect so much in premium. And as healthcare costs go up, well, premiums go up, but they're not trying to find a solution of saying, how do I make this easier? How do I prevent these kinds of things? That's where we've taken a total 180 from the healthcare industry and forward thinking, saying, okay, how can we, through technology, if I can sit there and I can order food, groceries, delivery of anything, I can buy a car. I could buy a house sight unseen right now in any state, including Hawaii, off of this. So why can't I not get my health care the same way? So it's just a different way of thinking. And it's not the end all. You hurt your finger and you need, someone to poke a prod and see, do you need an x-ray? Yeah, you're still going to have face-to-face. And that's perfectly fine. We're not trying to replace anything. I think that's a lot of people conjure up is that, we're trying to be this standalone and we can do everything. No, we're just part of the healthcare system that is, now the Ferrari, right? You don't have to be, the Ford or the Dodge or anything. If you want that nice luxury feel of convenience, then this is the way to go.
Well, in my view, the healthcare industry, the health insurance industry has kind of been the gatekeeper of access to good healthcare for a long time, for far too long. And I don't think they like the competition, but there's not a lot they can do about it. Healthy competition is really needed in the market, and I think that's what that's one of the things virtual healthcare is doing. As far as government endorsement leading up to before COVID, for instance, Medicare had started to pay for virtual healthcare services for people who lived in remote areas and didn't have ready access to medical services. But all of a sudden COVID hit and they're all in, and that had a huge impact on the attitudes of the consumer and their use of healthcare, just as you pointed out. And that actually coincided with something else that was going on in the United States at that time, and that is an increasing shortage of primary care physicians. So this whole evolution of virtual healthcare is doing a lot in from what I see in offsetting that shortcoming. I mean, people, the cost of an office visit went up dramatically. It costs what, $200, maybe $250 now for an office visit, and the waiting time could easily be 4 to 6 weeks. And now you can pick up the phone and have an urgent care doctor consultation literally within 30, 45 minutes, and you can talk to your dedicated doctor within 48 hours. So I think it was so timely that this happened when it did. My experience has shown that new members are reluctant to utilize your services, and especially with young people. I do business with a lot of smaller businesses, and the employers will purchase memberships for their employees, but God bless them, they just are reluctant. I don't know if they're scared or what. And I know the first time they pick up the phone and get used to the process, they warmly embrace it. But do you have any wisdom for people in this situation that might, based on your experience, that might help them be more comfortable with picking up the telephone and asking for medical help?
Yeah. And we're seeing a huge surge in this, Larry, with the younger generation, right? And because of everything becoming virtual, that they're just getting all their services that way. If I can't, if I can't go online and get it, then apparently I don't need it. So the healthcare, I think it's just ingrained, in okay, I'm sick. What do I need to do? Okay. And that's also why claims have gotten so out of control, is because someone automatically runs off to the urgent care or to the emergency room when it's not even necessary, and so that's where a little change in the education process, but more so that they're actually able to now conveniently pick up the phone or go online. Of course, we always have our 24/7 call center that can help someone out that making appointments. So it is a change there that we're actually starting to see that generation embrace it a lot more.
When it was just telemedicine, a telemedicine doctor, because they lacked the ability to get more extensive diagnosis, lab tests, et cetera, they could diagnose and treat about 50 common conditions. I know when I was first, and one of your senior employees introduced me to MyTelemedicine and this whole concept, but when she first introduced this to me, she pointed out that can eliminate up to 70% of expensive trips to a doctor's office. But now that you've got virtual primary care, you can go out for labs and extended diagnostics and treat up to 1,500 different conditions. Talk to me about this new virtual primary care and the one-on-one doctor relationship that you've created.
Yeah. So we want to take a face-to-face visit into the virtual world. You've seen the movies and stuff where someone puts on the goggles and they're just, they're right there.
Sure.
It looks like they're with the person. Guess what? That stuff is happening, right? That stuff that's going to be here soon. But in a virtual sense, we can take care of basically a lot of chronic needs, daily medications and stuff, by getting proper labs. If there's imaging, mammograms, colonoscopy, all the stuff is ordered by your primary care doctor, right? That someone is going into, and, if there is something, again, that needs to be poked, prodded, hey, I've got a bump here, so then maybe some of that needs to be done. And that's where our care team actually comes in. That's what makes Lyric a little bit different too, is that because we understand the virtual side, and also the side of having someone that may need a little additional assistance, right? Based off of that, if we can now have somebody, call in and say, hey, I need to get an annual wellness exam. Well, guess what? We can actually do that. I mean, it's crazy. From thinking a couple of years ago, right? It was just urgent telemedicine, but the person can actually pick out the doctor that they want to see. They stay with that same doctor for follow-up care and all. And if a specialist is needed, if a lab is needed, if anything is needed, then that goes to our care team, and our care team then assists in making those appointments. I know it's happened to me. I've gone into my primary care doctor, previously, and, oh, here, you need this done, and they write a script, or, give me a referral sheet and hand it to me. Now it's a list of 10 different specialists, and I need to go get this taken care of, or, hey, you need to go get these labs done. Where do I,
Right.
And so now the onus is on me as the patient to figure it out. Right. Again, this is staying, now a step ahead of things, where those types of incidents, anything that is ordered by the doctor goes to the care team, and the care team makes sure that someone's comfortable in knowing where they need to go. Do they need to use your insurance? Is this a cash pay? All the hurdles that's going to stop somebody from taking that next step, because continuity of care, right, it's a big hole out there for most of, anyone's health plan. And the more that we put it on a consumer, that's part of our issue. I think you're talking about a decrease in primary care providers, right? There's still over 350,000 primary care providers in the U.S. That's a lot. Okay. Now, the reason that we say it's a shortage is because the population is using those doctors in more ways than just chronic, right? Now, every time, I get a sniffle, I'm running off to them, and because I've got to go and sit in their waiting room because they're not doing virtual care because they have my insurance and all that. Now it's overloaded, and so when it comes to a person saying, hey, I need to go get an annual wellness, right? Which is critical, because that is where those underlying conditions are found before they pop up, right? And it's all a matter of, people don't go to the doctors because they don't like them. It's not because they don't like the doctors. What they don't like is the process. Meaning, I got to select a doctor out of this huge PPO network. I got to drive. I got to make an appointment. I got to make an appointment 2 months from now and wait, right? Larry, I barely know what I'm doing 2 days from now unless my wife tells me, right?
Sure. Yeah.
So hopefully in 2 months, I still have that date available. I got to go fight with traffic.
And you're still alive.
Yeah. I got to gas. Now I've got, 500 emails that I missed at work that day. Or, as an hourly worker, I just miss out on time for what we think is nothing. We're thinking, hey, I'm breathing, I'm walking, I must be fine. And you know how I know this, Larry? Because it happened to me.
Oh, tell us that story.
So from this personal incident, when we talked about going from urgent care to primary care back in 2021, it was all about access, because that's all that really urgent care was better access. And as we're, putting together this program and better access, well, I had gone off on a business trip, and it was to Nashville. It was a fly-in, meetings, dinner, next morning fly back. I'm in the Dallas-Fort Worth concourse, Terminal C, and I'm walking off the plane, and I'm out of breath.
Yeah.
Right. And my heart is just kind of pounding. Now, I know the symptom of a heart attack and stuff unfortunately, very well. And I knew it wasn't that. And it's because I had previously been feeling bad, already. And I'm just like, man, this is just, that it's kind of getting to me. So I get in my Texas limo, my truck, all right, from the Dallas, airport, heading home. And I call my wife telling, hey, I'm landed just fine, headed, to the house now. And I'm telling her, man, I had this episode. She goes, you need to go to the emergency room. Like, like the videos, ain't nobody got time for that. It's like, I'm way too busy. I gotta, I've already been on a flight all morning, and driving home, I got to get home so I can check my emails. And she goes, don't stop. Don't walk in this door unless you stop. And so I'm like, all right, I live, rural area outside of Dallas. And so I thought, well, if I go to the emergency room there, maybe it'll be quick. And the doctor's going to tell me, hey, Wayne, watch what you eat, get some exercise and stuff. So I'll walk in there. I'll tell you what, you ever want to get into the back of the emergency real quick? Go to the ER reception and go, something's kind of going on with my heart. Man, yep. It's like bells, whistles. They're on the PA system. Guys are rolling out, the wheelchairs and stuff. So I get back there pretty quick, even though there wasn't really hardly anyone, in the waiting room to begin with. But they run these tests, right? Mm-hmm. And I'm going to make a long story short that I had to stay overnight and then had a cardiology appointment the next morning to go over the tests and stuff. And after doing multiple tests at the very end, it's because I had 2 underlying conditions that both of those are under control with 2 $5 generic medications. Right? A stress event is what triggered this, from going. And so these things combined, sent me into the hospital. But worse than that, Larry, is that now I had over $50,000 medical claims. Because now we're talking about, ER, hospital, doctor, 5 different doctors, built all kinds of stuff, and just to come to find out, and so the cardiologist said, "Well, wait, with these 2 conditions, why didn't your primary care have you on this?" Well, because I didn't go see him. Well, why not? Because I was feeling okay, and if I did go, right, then the labs that would, if the lab wasn't there, because I had at one time a primary care physician that I went to regularly, and they had the lab right there in the same office, and they run it, right? The last primary care provider that I had didn't, and they'd write it out and say, here, go to Quest or LabCorp and get this blood draw. Well, I'd sit in my front seat, and my kid would jump in, the car. A couple of days later, it'd blow out the door. No one was following up with me. Again, I thought I was fine. And as my grandpa used to say, you're good until you're not good. And so I sat down with the team. I said, I think I'm average Joe consumer, right? buy the same cars as everybody else, buy the same house as everybody else, travel the same, right? Do all this, same. And I probably consume my healthcare the same way. And as I was, doing more research and finding that even in an employer market where it has rich benefits, only 30% of those employees actually go and get a annual wellness exam. I'm thinking, they have insurance, right? So why is the 70% not doing it? Of course, you got this small 20% that are young, healthy, right? Maybe an older healthy, and just they don't need to go. But then you've got this other, 40%, 50% hanging out over here that was like me, that was just walking around waiting for something to happen. And these catastrophic claims, right, stem mostly from that. And how I know that is because that over 51% of all catastrophic claims, the person had 2 or fewer claims previously. So that's showing that someone that typically it's a medical event that gets someone into a disease state, that they finally know they're a diabetic, that they finally know that they have hypertension, right? Is again, the Wayne Orders out there that, oh, okay, I need to be on the drug, but it costs, I'm with a cost share insurance, and so it costs participants $50,000 for Wayne to learn that lesson. That's not how we should be. So I'm like, okay, how do we go about doing this? And what was stopping Wayne from, getting the help? And it was the process. It was all about that. I said, then let's scrap the process. And I sat there on a whiteboard and had bullet points of what's the process now? What's the regular healthcare process? How can we take care of this? So much so that, if somebody, especially at that time, with COVID going, at a pandemic, if someone didn't want to go in and get a lab, we have labs that we can send to somebody, at home, because of the, now technology and all that it is. So is now someone can sit there and feel very comfortable. So my primary care provider is virtual. And I've had my labs virtual. I've had imaging done on a virtual basis, MRI done on a virtual basis, so I'm being taken care of 100%. Again, if I do need, to go to someone, well, I have my insurance, PPO, that I can go in and has a touchy-feely and all that. But I'm very secure in my health right now because I'm being monitored and kept up by a care team and having my annual physicals, right, done, my annual exams done every single year. And a board-certified medical doctor is overseeing everything.
Well, we're all in the same boat, Wayne. I mean, we all do that. We all procrastinate going to the doctor. I know I've seen statistics that indicate that the United States significantly underutilizes primary care medicine compared to other developed countries, European countries, et cetera. And that's one reason why we have such high major medical expenses in the country. We're just not taking care of ourselves. But I know, again, from my own experience that, for instance, since I went on Medicare, since I aged out and went on Medicare, my Medicare provider, it's an HMO, and their facility, they have a major facility within minutes of my house. And I can and do utilize telemedicine with my primary care provider, as well as some specialists, and I can go in anytime I want and get lab work or see the doctor just on very short notice. And I'm probably taking better care of myself now than I ever have. But I haven't had any major conditions, but I see I have more primary care visits, and I feel better about that. But most people don't. They just avoid it.
Thank you for tuning in to Next Generation Healthcare, brought to you by Optimal Telehealth. Your engagement means the world to us. If you find our content informative, follow our podcasts on Apple, Spotify, or YouTube. We welcome your participation and will review listener input in future episodes. To leave your questions or comments, access additional episodes, or browse our blog post library, please visit the resources page at optimaltelehealth.com. You may also connect with us on LinkedIn, Facebook, or Instagram for the latest insights and updates. We look forward to welcoming you back soon. Your journey towards empowered healthcare continues with us.